morning, everybody. I'm Ebony. This is Jared, and we're gonna talk to you about cervicogenic dizziness. Okay.
All right, for our objectives, just to learn the distinguishing factors of this, to identify potential causes, signs, and symptoms, to determine appropriate tests and measures, and discuss plan of care, interventions, and outcomes. So, what is this condition? It's described as a dizziness or vertigo. So it's non-spinning. It's kind of like an imbalance or disequilibrium. So it's kind of like you're on a boat. That's kind of like the sensation you get. So it stems from cervical spine dysfunction, which can be pain, stiffness, numbness, or weakness, and also limited motion. And while it can occur in children, it's more prevalent in adults. We found some studies that it's more prevalent in females more so than males. And there's no real consensus yet on the criteria for diagnosis.
So this is basically a picture of showing how you basically feel the symptoms. One is a headache, and then the other one is just pain caused by the neck. So what are our causes? So the causes we have for you today is tightness and strain in muscles. So stated in prior lectures, we were taught that tightness in muscles can not only cause soreness, but can cause other dysfunctions. So the most common muscles that cause this condition that's caused by tightness is the sternocleidomastoid. Other muscles are also called the occipital muscles, such as the rectus capitis, post, minor, and major, and oblique capitis too. You also have joint dysfunction and injury, balance issues, neck pain at rest, movement, or palpation. So as we was talking about in other lectures, we talked about trigger points. So when you're a physical therapist and you're actually assessing the area of the neck, they have certain trigger points they have. So when you touch it, it's really, really irritating to touch. We also have delayed onset secondary traumas. For example, a good one is whiplash when you have a car accident. The way you overextend or flex your neck, it can cause a strain, and that can cause inflammation. That can also cause the symptoms. Cervical thoracic hypermobility. So what are the clinical manifestations? So as we said before, it's also called vertigo, cervicogenic vertigo. The patient may demonstrate dizziness, a lot of neck pain, especially to the touch, loss of balance. It's a lot of motor and sensory issues that happen with this condition. So lack of spatial orientation, that means you have problems knowing where you are and how you got there. Lack of coordination. You also have headaches. That will probably come up in differential diagnosis because you need to know what's the difference between a migraine and cervicogenic dizziness and headaches. So just pay attention to the area of the headaches. Also nystagmus, which is when your eye has involuntary movement, so it shakes basically.
All right, next we just have some functional limitations. So this is limitations of function and related to the cervical region and also to secondary to vertigo symptoms. So this will present as balance issues, reduced mobility, ADL disruption, headaches, and postural inhibition. I got an example here. So I had a football coach. He played 11 years in the NFL, and he actually had this. And so like during meetings and whatnot, we'd be like watching film and stuff, and he'd have to pause, lay down on the floor because he started getting dizzy from this. So it can just cause just overall disruption in your daily life as well. So for test and measures, so special testing you'll use is you'll test the myotomes, dermatomes, the deep tendon reflexes. You'll do neuro screening, cranial nerve function testing, and upper motor neuron signs. So when your patient comes in, you just kind of had to use this testing to rule out things, and also test the equilibrium and balance testing. So other special measures you'll use is testing active range and passive range of motion, manual muscle testing, MSTT, and you just want to look for reproduction of symptoms.
Okay, so for differential diagnosis, as you see, we have pathologies for the oculomotor. As you stated before, the nystagmus was one of the signs. You don't want to get that confused with a cranial nerve disorder. Vertebral artery occlusion. For example, what that means is vertebral basilar insufficiencies, cervical instabilities, vestibular disorders, Meniere's disease, BPPV, and whiplash disorder. How are you able to differentiate? Oculomotor evaluation, this HAP pipe test, head neck differentiation test, rule out other pathologies as well. Symptoms consist with neck pathologies, root cause. Another thing that goes with vertebral artery conditions that may be misconstrued with this is blood clots in the area. Blood clots cause a lot of disorder of the entire body, so a lot of research was done and said they kind of get that confused with the cervicogenic disorder as well. So for interventions, we would do manual therapy, cervical traction, cervical stabilization training, therapeutic exercise, different modalities, monitoring reproduction of dizziness, and analgesic and anti-inflammatories. Fun fact, when I was in clinicals, we had a patient that actually had vertigo. He was coming in. He was working full-time every day, but he was still able to drive, which was kind of odd since he has those random conditions. But for his conditions, we also had stuff for balance. We did a lot of step ups, but we added weights to his. So whenever he get dizzy, we kind of try to make him maintain that posture instead of just falling. He'll actually be able to maintain himself. We also did a lot of active range of motion in the neck to help him, and then to accommodate him if he did get dizzy because it was new to him. We had a seat beside him just in case. So just be on the safety side. Safety is always first.
All right, so here's some of the rehab stages right here. So you're gonna start with stage 1, the max protection phase. So this is gonna be more like a conservative physical therapy. During this stage, you're gonna take anti-inflammatories, pain meds, and then you're gonna do joint moves and manual therapy with your patient here. So stage 2, more of a moderate protection phase. So this is more stabilization and postural training. You're gonna do more cervicothoracic strengthening. You're gonna use modalities like E-stim, and then add in like some mobility challenges as well. Stage 3, minimum protection. So this is gonna be more dynamic mobility challenges, progression of strength training, dynamic postural challenges, and progression back to work, back to function. So this slide right here, we have some just common exercises utilized for this condition. So you got your chin tug, scaling stretch, your neck rotation flexion, all that stuff right there. All right, so for outcomes, recovery varies from a few weeks to years. This is case specific for, everybody's different, so it just depends. There's usually a full return to function with extinction of symptoms though.
So for the overview, we have cervicogenic dizziness is a form of vertigo. But you want to know there's different types of vertigo, so make sure you're able to distinguish the two. The way you distinguish the two is the cause. This also stems from dysfunction from the cervical spine. It's also mostly diagnosed with vertigo as accompanied with neck pain, and usually diagnosed after form of vertigo is also out. These are our references.